Many of us have aging parents or loved ones that need medical care. Doctors are busier than ever with little time to spend with each patient. And this can be frustrating for both patients and for family members who have questions and concerns that are left unanswered. Well, is there a solution to this with a healthcare system that's facing a shortage of primary care doctors? On average, most primary care physicians will spend between 15 and 18 minutes with each patient, if they're lucky. And that can include diagnosis. Now, this is often after waiting for the appointment as doctors are overbooked and running late. So what do we do? Well, today we speak with Dr. Gerda Maissel, an MD with an impressive resume turned patient advocate, to help us not only with those that we care about, but give us some clues on what to look for in care that may even impact our care in the future. So stay tuned. This podcast is brought to you by DJ Works Media with resources and ideas for you at mid-career or half-time of life. Check out our online courses where we want you to not only start, but finish. Books available in all versions and songs available for immediate download with sheet music and instrumental accompaniment tracks. Our musicals are family-friendly with great music that's memorable and inspiring. Sign up at goalsforyourlife.com/newsletter for weekly updates. Now to our episode. Well, I'm so excited to have, I'm going to try to pronounce Gerda's name correctly now, Dr. Gerda Maissel, like the marvelous Mrs. Maissel. So I'm so excited she is here today because she has so much to share. I'm going to let her share a little bit of her background as an MD and now as a patient advocate. And if you are at mid-career, half-time of life, this will impact you big time today because there are either parents that you're starting to care for or that you have cared for. You may have a family member you're caring for. You're going to think about your own care in the future. So I'm excited to hear what Dr. Gerda has to say. So hello, thank you, and welcome. So
thank you. It's wonderful to be here. And yeah, my name is tricky. So I pronounce it Gerda Maissel. So, but I answer to a lot of variations on that. And, however you want to call me, just call me. It's fine.
That's great. Just call you. Well, give us a little bit of your background as a physician. And it's quite impressive. But also, you've been in the medical field. What led you to your current work? And kind of describe a little bit about exactly what that is.
Well, so it was a little bit of a journey, like all of us. You start thinking one thing and then you do something else. And, looking back over the course of my life, I actually, and I promise I won't talk for hours on this, but I think what really influenced me to become a physician was what happened before I was born. In 1958, my mother became pregnant with my older brother and she caught German measles. And back in the late 50s, they weren't so aware of what German measles does to a developing baby. And my brother was born with congenital rubella syndrome, or what my mother said was, your brother's retarded, which is a terrible thing now. We wouldn't say that, but that's what I grew up hearing. And essentially what that meant is my older brother had a lot of cognitive deficits as well as reduced hearing and vision. And he was in the household until I was about 5 years old. And then she was pregnant with my 6 years younger than me brother. And my mother made a very painful decision, along with my father, to institutionalize my older brother. And so I have lots of memories in childhood of going to visit my older brother. For anybody who knows anything about the institutions in the 60s and 70s, they weren't such great places. Without going into gory detail, I can tell you that when I smell sewage, I think of my older brother because of the stench from those places. But growing up and then eventually deciding what I wanted to do, I think I felt a real pull to help families and individuals in the healthcare system be seen as people. because I used to watch the struggles that my mother faced trying to have my brother seen as a human being as she faced the doctors and the nurses and the difficult situations. And so I went into medicine. I ultimately picked a field called physical medicine and rehabilitation, not at the time thinking about people with developmental needs, but really still thinking about wanting to make sure that people were seen as individuals in the context of their life. So I worked as a physician for a number of years, got pulled early and often into administration. My last 10, 12 years of employed work, not self-employed, but working for organizations, I was at the C-suite level. So chief medical officer, chief transformation officer, medical group president, usually inside a 4 to 6 hospital system with, 500 or so physicians working for me. And when the pandemic started, I was down in Florida. I was now president of a nice medical group. But my mother, you talk about sort of being pulled and trapped in the middle, my mother was still back in New York. I came up for my first summer in that new job. That was that first summer of the pandemic. My mother was isolated and alone. And I had realized in my new job in this corporate world that it was same stuff, different place. That a lot of what I was being asked to do as a healthcare leader was cut the budget and then cut the budget again and discipline doctors with bad social skills. and that wasn't meaningful work. I went into administration to make things better for patients, to make things better for doctors, to make things better for staff. And cutting the budget and telling the doctors they should be happy with suboptimal staffing was really not what I wanted to do. Mm-hmm. And that combined with my mom, I said, I got to do something else. And so I left and started this business as a private patient advocate. And now I take all that knowledge that I have, the business world, the clinical world, my own sentiments that people should make fully informed decisions with their healthcare. And I combine all of that. And now I have this small business called MyMD Advisor, where I advise people on their healthcare journey when it's something complicated.
Wow, what a journey. And really hearing about, your brother and you developed the heart. And that's important, especially for an advocate. And wow, what a journey there. And I know you're going to help a lot of people. We face this, my husband and I, when we started losing our parents, and especially with my mother-in-law, my husband had to be there at that hospital, at that, all of those areas. So we're going to talk about that and how, you go about helping people in doing that a little bit. And you've been called also this medical Sherpa. I love that. I just think of climbing a mountain because I talk about Hero Mountain. And so what do you actually do now as a private patient advocate? And what should we look for when looking for somebody maybe like you to help us through this journey? Because a lot of us are going, okay, so what do we do now? And we figure it out. You got to just as you go along. But now you're providing some guidance. So can you enlighten us a little bit on that?
Yeah, well, as a physician, my specialty within this world is helping people with complex medical issues. So what that means, if somebody just has something straightforward, they have a hip replaced, something relatively easy, you don't need somebody like me. But, for someone that's hospitalized with multiple medical problems, you've got all these doctors coming at you and you, the family, are running around trying to understand. And then you realize that the doc that you're talking to is not the doc you talked to yesterday, and that the hospitalists are changing constantly and the specialists are not talking to each other. And you're getting called in the middle of the night to make decisions that you don't feel fully prepared for. That's when you need somebody like me, because what I do is I follow the journey along with you. I help you understand, and I help people ask the right questions in the right way to the right people. It's so easy to know something's wrong and yet not know who's got the answer to your question when you're trying to help somebody else.
Wow.
And I do also help people in the community. So it doesn't have to be folks in the hospital. In the community, sometimes a person will have, the 6 doctors, none of whom talk to each other. Sometimes they say, one doctor says do this and the other doctor says do that, and they contradict and they don't know what to do. And I help sort that out. And I do a lot of work in the community with people on, 20, 30 drugs, and that are causing them all kinds of side effects. And I give them ideas as to what each drug is for. And together we figure out, okay, let's go back and talk to the doctors. Do I still need this drug, or can I take it in a lower dose? That sort of thing.
That is so valuable to have that, because sometimes you just don't know who to trust, and you don't know if they're saying different things. I mean, I do the same thing. I'm questioning a medication a doctor's giving me. I better do my own research too. It's just doctors, they don't know everything. Oh, well, I've had nobody have these side effects, and I'm looking at the side effects and I'm going, oh man. No, I don't know. You kind of need that sort of person to bounce things off of, to make sure that it's not going to be more harm than good, and with the longevity of that, and especially with the multiple. And we found that with my mother-in-law, there were multiple doctors, multiple things that she was dealing with, and so it's starting to get confusing. And with medications, when they were starting to pile on those medications, and now I find even pharmacists start asking you what you have and making sure, because everybody's liable these days. So you just want to make sure, some of those things. But man, you need, if there's that complicated journey, which people are living longer now. And by living longer, there's more things we can face, aren't there? So I know you can talk about that one too. And then some things to guard our health as well. So, but you talk a lot about, okay, so tell me, just before we get to values, this medical Sherpa, how did that come up? Because who started calling you the medical Sherpa? Because when I really just think of a guide, of course, that's what they are. But I love that term. So who put that one on you? And then let's talk about the importance of values.
Sure. Well, the medical Sherpa term was literally a nickname some work colleagues, in my new world. I have some networking groups, and there was one of the groups that I belonged to, and I think they gave that to me because it rhymes. So they're like, "You're Dr. Gerda, the medical Sherpa."
Oh, that's so great. I love that. That's very, very brandable, by the way. That's great.
I liked it too, but then I was told by a couple of different DEI people that Sherpa is a cultural name. It's the name of a group of people. I thought it, just like you, I thought Sherpa meant guide, and I thought, oh, this is perfect. But it turns out that for some people, using the term Sherpa wouldn't be considered okay. And so as much as I love it, just like you, I have decided not to, in general, I don't use it just because I want to be sensitive to people's, how people view themselves.
Right. I wouldn't have even thought about that. So that's interesting.
I didn't either.
Yeah. Can't please everybody though, huh? So, but you can do, tricky. Yeah, it really is tricky. So, well, I just wanted to know the background. I still love that term. So let's talk about values, and have those changed in your life? It sounds like they've been pretty consistent, especially because of your brother. And have they driven the different stages of your career with a purpose driven? Because I talk a lot about values in my business and how important those core values are and how that drives our purpose. Very, very important. And to reevaluate those usually a couple times a year at least. So why don't you talk about those values and how that has driven part of your business and your purpose?
Well, I think you're absolutely right. And values are incredibly important and sometimes very hard to articulate. You just kind of know what makes sense to you. Sometimes you just do what you think is right and you feel good about it. But in thinking about values, for me, I was driven, I think, by, like a lot of people, I really wanted to help others. I saw what happened to my brother. I saw what it put my mother through and my family. and wanting to help others have a better time understanding and working their way through the medical system has always been just a very important thing to me. But, also along with that, when I think about my own values, being determined, working hard. I went into medicine at a time where, we were maybe 20-25% in terms of being women in the class. And I, early on, it was, I was a lady doctor. Now I'm just a doctor because there's so many people, so many women have gone into medicine. But I was also driven by a desire for growth. And I think that's a good thing for all of us to hold on to. It's fun to learn. It's fun to be curious. And wherever that may take you, because there's just a pleasure, a selfish pleasure really, in learning new things and approaching new ideas with curiosity. You may decide you like the idea. You may decide that doesn't work for me, but being curious is I think an important value. And believe it or not, and I don't know how to say this in a way that doesn't sound super critical of health systems, but the higher up I got on the corporate ladder, the more ethics mattered to me.
And interesting.
Yeah. And I just, I think organizations have their own internal ethics, and sometimes they jive with your own and sometimes they don't. And then the other thing I think over the course of my life, I always valued balance. But when I was younger and I was working full time as a physician and doing leadership and had 2 kids at home, balance for me was just a matter of, I didn't want to tip. I didn't want to fall over and have everybody depending on me. As I've gotten older, balance for me becomes more about taking care of myself in a way that is healthy and sustainable, and really, making sure that I have enough time to actually relax. And I know that when I was younger, I didn't appreciate the importance of actually doing nothing. Or, for me, doing nothing now is reading, listening to a book and doing a puzzle or something silly. But that I didn't have any relaxation time at all when I was younger. And I got older, I realized that I needed it, and it needed to matter to me to have relaxation time.
Wow. That's very, very valuable too, because our bodies do change a little bit too. With relaxation, we were just talking the other day, my husband and I were talking about the amount of sleep. And I find myself needing, a little bit more sleep, which for me, I could easily go on 4 or 5 hours for years and work, do all of that. And now I'm feeling like, I need a little closer to 7 or 8 and I can't sleep in. It's just really hard for me to do that, but it's important. That's why those habits, and that's part of those values, making sure you get to bed early enough and all of that. So you can make sure that you get those, so you can be at optimal energy, and you spend enough time, we're putting travel in. So those are values at this point that weren't in my, to do as much travel together, weren't in when I was raising our 3 sons. We were just surviving pretty much and doing the camping vacations and all of that. But, so there was, it's different at different points of your life. And that's why going through these couple times a year even, and kind of tweaking them a little bit. Where do you stand now? And that's a very interesting point that you mentioned, the higher up in the corporate world, and where ethics mattered even more, or you probably had to face it more because of maybe some of the decisions that were being made. So that would be an interesting process there with all of the ethics. So anyway, but you're presently now an entrepreneur. And so you've had what I call, and when I talk to those that are doing some of these transitions from being in a business like a corporate world or working for someone, you've come from having a box. There it is, your box. And now an entrepreneur is taking that box away that was given to you, and now you're putting on your own box. And so that it's different. And if you're, with your scheduling, everything else. And so how has that changed in your life, and how have you made that sort of transition? Was it easy? Was it a little bit difficult on some of those days? And also job satisfaction, because it sounds like you weren't, all of a sudden you realized that you weren't mission driven anymore when you were at that the corporate level. You were getting to the place where you were doing things as like, why am I doing this? Why am I scolding doctors instead of helping patients? Just, what you want to do. So talk about that entrepreneurial journey first, and how that transition and how your box kind of changed where you were at. And then with all of the satisfaction part that enters there.
Oh, so that's a big question, but let me do my best and just prompt
Yes.
if I miss pieces of it.
Mm-hmm.
So in all the years that I was an employed physician and leader, I always had a little bit of a sense of restlessness. I enjoyed the work that I was doing, but I was always like, well, what else is there? What's around the corner? And I think it ended up, and it wasn't necessarily deliberate, as part of why I kept going up higher and higher. I sort of had this assumption, well, if only I was the boss, then everything would be okay. And, I'd be a little boss and a bigger boss and a bigger boss. But the reality was that while that work was great and I enjoyed many, many aspects of it, as I got into my 50s and later into my 50s, the latter part of my 50s, it was taking more of a toll than I realized. And for me, with the pandemic and that time where we all sort of slowed down and started working differently, that was a real time to look at my values and realize that I wanted to be present and back in New York for my mother, that I didn't want to keep up this frantic pace that happens when you're at a high level in a corporation. And I wanted to just help people again and get back to doing that. And so for me, it all kind of came together. While I was still perfectly healthy, I had gained weight. I did not have the energy to exercise the way that I wanted to. And I just looked at all the different facets of my life and I said, this just isn't working anymore. I need to do something different. When I had been younger, when I had thought about jumping out, I really had been afraid of giving up the steady paycheck. That for me had been a big fear. Even though it was ridiculous to be afraid of being, the fear of poverty, when you look at it, it's ridiculous. I had plenty of money in the bank. And yet I had an irrational fear that if I wasn't employed, somehow I'd become homeless overnight. I mean, I'm exaggerating, but I was just afraid. I was like afraid that I couldn't, that something terrible would happen. But then my children were educated and I was in a position where I was able to say, even if I make no money for a period of time or even lose money, I'll still be able to put food on the table. And I was able to say, I can cut back my expenses. I don't, we were already not eating in restaurants. We were already not traveling. It was a pandemic. And I thought, this is a good time just to do something different. So for me, it just kind of came together. But for other people, I think there's a journey and people get a sense of when it's right to make a change. And it's not always that things are painful now, because there's always a little bit of pain in life. I think it's fear. At least for me, it was fear that held me back more than anything else. And I had to make an educated, not painful, but fearful, apprehensive jump into this other world. And I gave myself 3 years, and it involved talking to my husband and making, a bargain with him. Because of course, I was well, you don't know this, but he wasn't working at the time. So I had said to him, we're going to need insurance. Are you in a position where you'd be willing to go back to work? He'd retired early. Would you be willing to go back to work so that we can have health insurance while I do this? And, after some back and forth, he said yes, that he would do it. And so we worked out a way for our family, for he and I, to be okay while I went on this experiment. And then I was terrified for about a year and a half. I didn't know whether that, because what I decided to do is not like there was a job description for being a patient advocate. I didn't even know at the time it was called patient advocacy. I just knew that there were so many people who got lost, who didn't know who to trust, who suffered, families who suffered when their loved one was ill because they didn't have anybody advising them. And so I said, I think this is a business, but let me try. And it took me about a year and a half to exhale, where I went like, okay, this really is a business. And now I'm 3.5 years in, and I'm crazy busy and loving it.
Oh, that's wonderful. That is just, and you gave yourself a little space. I like that. And you kind of gave yourself also a little bit of a safety net. And I've been in a business, especially an entertainment business, and there have been so many messages through the years of just go for it. Just go for it. Give it. And then, I find a lot of those people are living in their car. They're sleeping in their cars. They're going for it. No, you made sure you were at this point in your life where you could do that. And you had, a spouse, and you're able to say, okay, can you go back to work? We can get the insurance. We can, make sure we're taken care of. So those were really good safety nets for you to be able to put together. But also you gave yourself this year and a half. And I think that mindset is very, very healthy, Gerda, of just being able to say, it's going to take a little time because it's not going to happen overnight. And now you're busier than ever, which is wonderful. But you've given it time. You've worked hard. And what is your work day like? And how hard did you work to get to this point? I think that's another good question, because some people think, it's just going to kind of magically happen if I've got this field that people need. People need so much. I see all of this need. Now, are they just going to find me, or what's going to happen? So how was that? It sounds like you're pretty well networked. That's a big deal. That's a huge deal, in fact, because if you are networked well, referrals are those are gold. So, but how have you actually started building this business a little bit more?
Well, so that's a great question. And I'll tell you, when I started, again, I had no idea what to do. I had this fear. It's the only word I can describe. And people said to me, you need to network. Now, in my mind, networking meant you showed up in a giant room with 300 people that you didn't know, and they're all running around kissing the air, superficially having conversations and handing you their business card. I hated that idea. I had never liked what was labeled networking events because I found them ridiculously superficial. I like having real conversations with people and getting to know the human being. I'm big on who are you? Whatever your story is, let me just have a glimpse of you as a person. Luckily for me, with the pandemic, when you do a virtual group, most virtual groups have little breakout sessions. And if you go to the same groups repeatedly, you can start to get to know the human beings in the groups. And for me, that felt meaningful. It felt like real connection, because I like doing things that feel like they have a connection to me as a human being, not just things that artificially promote my business. So yes, I'm happy to do this podcast with you, but I'm doing it because I was curious about the kinds of things that you say to people, the kinds of journeys, and because I wanted to help people. And if turns out that I get some business, terrific, but I give lots and lots of talks just for the sake of giving them, not because they're going to bring me business. And so part of this to me is each one of us as individuals has to pick what is a meaningful activity. And so for me, networking was finding a few groups where I could develop some meaningful, real connections with people. And then when those people got to know me and I got to know them, then it turned out that some business started trading hands. Oh, somebody needs a lawyer who does this or that, or they need an accountant for this or that. Then I was able to say, oh, I know somebody, not I have a card from someone, but oh, I know Jane or Joe, and they're really funny, or they're really, oh, they've got kids your age, or something where I could connect the person to the person and not just give a name. And by developing networking through actual relationships, for me at least, that has turned into great business.
I love that because the introvert in me does not like showing up at big groups as well. I mean, I'm an entertainer, so I can put on that hat. I can put on my extrovert hat. But it's like, I can't tell you how many business cards I've ended just throwing away because I've kept them after these. And it's like, I know nothing about someone's background. And the reason I have kept working in the music field through so many years, still do actually in some different ways, because I still work with Disney and some other private events, but it's because of referral and because I show up on time, I do a good job. People know what I do. It's very unique in many ways. And so they know what I can do. And I have a group of friends that we refer each other because we know what each other can do. And then if there's someone else, we go in actually listen or actually see what they do. I don't do that as much anymore, but it's I have a friend who got me into some of the things or has referred me, but I just remember the first time she showed up at one of the engagements I was performing at, and I still remember the smile she had on her face. And it was like, I know who that is because I've talked to her on the phone, but she wanted to come and hear me before she would let me sub for any of her events. And so it was very, very important that way. So I think in this referrals and getting to know people and keeping those contacts with trusted contacts.
Right.
There are some that, I would never, ever refer them. They can be in one of my relationship circles that kind of on the outside, but they're not going to be on more of the inner. Talk about relationship circles, how important those are as well. So, but they're going to be more, and it depends. There's different types too, whether they're business or personal. So, but I think that's such a good point with, you have your trusted people, getting to know them. And I've enjoyed a lot of those Zoom. I still have a happy hour that's been going that started on Zoom. I set it up every 2 to 3 weeks when I'm in town. And we, with some people across the country, just a few of us, they didn't want to quit. They wanted to keep those relationships alive and update. What are you doing? And keep the accountability going. And it's very, I'm putting it together still because they want to keep going. And some of them have been friends for years. And that's why I do it. I wouldn't do it just for anybody, but it was just, wonderful to have the value of some of those relationships. And those relationships are great referrals because they will refer you with people that trust them. And then it just branches out from there. I'm so glad you're very, very busy because that really shows the value of relationships and how you have developed that. And, I don't show up to a lot of these extra unless I'm asked to come and give content or speak or do something, because why am I going to take my time to do that? Your time is one of your most valuable resources. So to realize that. So,
and I think that's right, Deborah. As I've gotten older, I've let my inner introvert come out more.
Yes.
Because of the job that I did before, I expanded my extrovert. I clearly have one of these personalities sort of on, I could go either way, but now I'm choosier about events that I go to. And I look at it through the lens of how do I want to spend my time? And when I was younger, I always went because I thought that it was important to show up and be seen and make those connections. And now I'm trading off, but then I'd have to give up my rest time or my exercise time. And I've shifted my priorities a little bit. Now, part of that is as I've gotten older, I have to recover from things more. I haven't had any recovery time ever from anything. So part of it's practical, but part of it is deliberately choosing to lead a different life now, to sort of be comfortable being in that phase where I don't have to prove things to people anymore. I only have to do what I want to do because it feels like the right thing to do. I don't have to, for me personally, I've been a boss. I know how to be a boss. I don't need to run anything anymore. I can just show up and be useful.
Oh, great. I love that. And I love the phrase. And this will be, this is going to be in the notes.
Give me 1 second.
Oh, sure. No problem.
I'm so sorry. I've got to text him that I will be available at 2:00.
That's okay. Because you can just go ahead and text, and I'm going to focus on the phrase that you said that was a real standout, and that I would love people to take away. One of the things that they take away from this podcast, and this will be in the show notes, of deliberately choosing to live the life, a different type of life. And this is deliberately choosing to live a different. This is what people are facing right now at mid-career, at their halftime of life, thinking, what am I going to do next? Well, you can make a deliberate choice on, sometimes you're going, oh, what's next? What should I do? We'll kind of go through some of those. Don't be afraid to try. You can, and don't be afraid to fail, which you kind of have to get past that to be getting over on over that fear. But that, I tell you what, that goes, I've been a gig to gig in the gig economy for years, and you're wondering, okay, where's the next show? Where's the next, it's the same sort of feel. And so that's why the business development is so very important. And I've learned that actually even more, like, I think too late, but anyway, no, really not too late. I have so much product, and now it's focused on, I've done a lot of legwork through the years, and it's paying off now, which is wonderful. So, but I really, you focused on this, on the time for yourself and everything. And you asked, there was one of these little questions that when we were talking about, what to cover in this. And there was a little question that you put in that, in what advice that you can give for busy women. And I think that's a great question. And I know this applies to men too. If you are listening to us, we have a lot of men that listen too, but what advice would you have because you've been an MD, so you know what busyness does, you know what stress does, you know what not having time for yourself, not having time for sleep, and you know what all of those do to the body. So what advice do you have?
So I will give you the words, and then I'll explain that somebody gave me advice, how she said it, and it hit home for me. And then I'll tell you what she meant by it. Which she said, buy socks at Costco.
Oh, I love that. I buy socks. Sometimes I buy socks at Costco. I love that.
What she meant by that, this was at a time in my life where I was the most overwhelmed. I had been with my first husband. We had just split. I had 2 kids at home, one of whom had special needs, and I was working more than full time, and I was just, my brain was exploding. And I was talking with her, and I said, I have like 3 giant laundry hampers full of socks, and I don't even have time to match them, and I was just saying, I was simple to her of how insane my life had become. And she said to me, buy socks at Costco. I said, I can't buy socks. I have 3 hampers full of socks. She said, buy the socks, Gerda. The little bit of money that you would spend will relieve this at this time in your life, and you will feel better. And as this sort of windstorm of busyness passes, you'll have an extra 6 pairs of socks, and it won't matter. And it's such a trivial amount of money. And I thought, she's right. And so what I'm saying is hire help or spend a little bit of money buying an extra pair of socks or 2 or 6, whatever it may be, even though, it's not a thrifty thing to do because you already own them. Sometimes when you're crazy busy, you just have to spend a little bit of money on something that will reduce your busyness. And the reason that I mention this specifically for women is that I have found that women will be reluctant to hire or ask for help. Women tend to have a little harder time asking for help, but they have an even harder time hiring help, whether it's, often it's childcare we're talking about here, but it could be for something around the house. And so they'll say, but my husband should do it, or my wife should do it, or whatever. They're supposed to do it. And, at some point in time, if it's driving you that crazy, just deal with it and move on. If it's a modest amount of money that you can spend to get your sanity back.
I love that. I just love that. And, it's so funny because I do, when I find the right types of socks, I do kind of stock up. It's just hard for me to throw some of the older ones away. But by the time, when you notice the holes now, it's like, okay, just got to get rid of it. Got to get rid of it. No, don't just keep one. Yeah, throw them both away. So it's, but a lot of us grew up very, very thrifty. And so when you're thinking, this generation, maybe the next generation will be different. They won't care. But boy, still my generation, a lot of us were just scraping along as we were just having kids and trying to, just make a living. So when you think about buy socks at Costco, I just loved that. I think that's just the greatest word of advice because I don't know, every couple weeks I am at Costco, definitely. So there's just 2 of us now. So I just have to be careful to not overbuy. So, shampoo for a year.
None of us want, I'm not saying be part of, consuming for absolutely no reason. I'm saying give yourself a safety valve.
Yes.
If the amount that it might cost you, whether it's by hiring a human being or picking up a 6-pack of socks, give yourself a break and a safety valve rather than getting frustrated or overwhelmed. Because when you're super busy, sometimes you just have to do what you need to do in the moment, cope with it, and come out the other side.
That's great advice. Great advice. I tell you that if everyone is hung together with this, the whole podcast, hopefully, that is a diamond as far as, that saves a lot of stress. It saves, and it could save a lot of conflict in relationships because, by the time I always say with relationships, my husband and I we're going to celebrate 44 as we are doing this little interview. I'm sure it will be past this when I actually release this, but we're celebrating 44 years. So, there's a lot of major on the majors. That's what I say. Major on the majors, because there's a lot of times that you can just get so frustrated or just so, you're like, ah. But major on the majors and go on. And I love that because that applies to this. Do what you need to do for yourself to kind of alleviate, especially if you have those young kids. I tell you, that's a busy, 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 busy time. And I do understand that. So as we kind of close this off, what a great interview this has been. I've really enjoyed this time. And thank you so much for being a part. You asked me why I started a podcast. I just said, it's just such a fun platform. It's in my wheelhouse. I love it. I love telling stories. When I find stories that will be interesting to people and very relevant for those who are at mid-career, half-time of life. This is very, very relevant. My mission right now is not just to build a business. It is to help people and expand and to be able to have the influence on people that will really help them through this stage of life so they can start using those skills and experience and all those resources most effectively, because we need those people who are at this point of their life to be able to using those, because look at how many people you are helping. That's amazing that you've gone into that field, because I know that's a huge, huge value right now. So would you have one thing that you want to leave people with? And also how, if anyone wants to contact you for anything, they can look at your website. That'll all be in the show notes, and to see some of your what you have written and all of that, because that'll be a great value. But just give us, maybe one little takeaway, what people can do right now. And then, if you can think of one thing, I don't know. Sometimes people go, I have a couple of things. And also how we can contact you.
So I don't have a one thing sage word of advice for people, except to invite people, if they are struggling with their own healthcare or the healthcare of a loved one, they're more than welcome to reach out to me. I do offer, half an hour. I'll talk to somebody. I don't charge people for hey, what's going on with your situation? And many times I'm able to just say, oh, here's what you need, or explain, no, you're using the wrong word, or you're talking to the wrong person. And then I help them and then just send them on their way. And I'm more than happy to do that. People can reach me at Gerda at mymdadvisor.com. And my business is Gerda. Sorry, that's my name. My business is MyMD Advisor, and the web page is mymdadvisor.com. So it's really easy to get a hold of me. Happy to talk to people. Happy to help people. Sometimes people just feel stuck, or they wish they had a doctor they could just run something by. And I'm happy to do that for people. And if it's something I can help, I'll help. If it's something that I, know somebody who can help, I'll connect them. And I really just enjoy doing that for its own sake. I also love giving talks. I do many virtually, and give talks on subjects like, how many pills are too many pills. We talked a little bit about polypharmacy before, talking about how to, people in healthcare don't understand all the different levels of healthcare and subacute rehab and inpatient rehab, and people don't understand the economic drivers and, like why that nice case manager in the hospital who's trying to get you out the door isn't really working for you. And so there's a variety of content topics I'm more than happy to give talks on, or just talk to individuals about.
That is so very generous. I hope some people take you up on that offer, especially if they are going through a difficult situation right now and not knowing where to turn. And just having somebody trusted that you can talk to right now it's very, very valuable. And so thank you for that offer. And I know you've got resources on your website as well. So it's well done, and you can look on that website. So thank you again. This is just Maissel. I've got the last name now, Dr. Gerda Maissel. I got the pronunciation. I can mispronounce almost anything. So, but it's just been such a pleasure, and thank you all for listening. And of course, we come out with a new podcast every week, and sometimes more. We have bonus episodes coming out of a lot of some extra interviews. I have a lot of people that love to be interviewed. They love to talk about their stories. So, and I love being able to share them. So to make sure that you subscribe, and you also get our newsletter, because I put out every single episode. Everything is always in our newsletters. And I don't spam you. I just send you when we have new things, which comes weekly, and sometimes another time too, when the podcast is released and different podcasts are released. So that is goalsforyourlife.com/newsletter. Make sure you get that. All of the links will be in the show notes. And so thank you again, everyone, for joining us. And I'll look forward to being with you again next time. So bye-bye for now. Thank you for joining us. It is because of our wonderful listeners like you that we keep going strong week after week. We'd love it if you'd share and follow us to not miss a single show, and even write a review. You can also find all of our articles, products, and links at womenathalftime.com.